it's been very interesting with the onset of COVID. I think it's surfaced a lot of gaps in the way that practices are able to communicate with patients. Previously, there was not a strong need to be able to do mass communication with patients. The kind of form of communication that was done one-off around, hey, I need to send you a message about your prescription refill, or there's a new result that's coming in, or let's schedule you for appointment, or one-off that was kind of in the sense of appointment reminders, or kind of daily, or not daily, but regular appointment messages that may go out. But I think what certainly surfaced was the need to be able to mass message a large group of patients for a variety of reasons that could relate to either scheduling. So suddenly, the governor of your given state says, hey, you know what, medical practice needs to close down except for urgent appointments. And so suddenly you got to figure out, how am I going to message all the patients I have scheduled for the next month? And so unless you have a kind of a streamlined, facile way to do it, a lot of clinics are just picking up the phone and starting to call patients because you need to let them know, hey, cancel. So I think in the pandemic, as it's come out, practices have learned that, hey, we need to have a fast way to be able to adapt to all the ways, whether it's what we are currently experiencing in our own practice, or it's a government mandate that I need to be able to mass message patients, to educate them, to let them know what the changes are. And so I think that has been a really big impetus in getting practices to look at ways that they can do this, because it just isn't scalable to have to pick up the phone and call every patient. We talked about three things, which was educate, identify, and treat. And then we think this is kind of core to your messaging strategy, particularly in the COVID phase. But I think this is something that, as practices and physicians, we can learn and take to, outside of COVID once we are able to kind of leave this acute phase. So the first phase is educate. And what we really found was that, particularly early on when the virus was hitting, a lot of patients just didn't know what to do. And, just like any patient does, if you go search on the internet, you're going to get some truth, some lies, and everything in between. And it's kind of hard to figure out. And so really the source of truth for a lot of patients is their doctor, who they have trust in. And so what we saw, that a lot of practices that we currently work with and others who were coming to us just wanted a way to be able to distribute information to their patients. And this could be just educating them on what services are available during this time. As we're going into the COVID phase, like, is my clinic open? How can I help you? What can you do if you start getting symptoms? But also just basic things like, what should you be doing? There's a lot of theories about like how you can prevent the spread of infection and stuff. And so a lot of patients were looking for genuine information, and they didn't, and it was hard to digest what was out there. So the first pillar is educate, educate them about what the virus was about. The next step was identify. And this is really where I think providers took a lot of advantage of. How can I figure out, of the, let's just say as a physician, as a primary care doctor, I may have 3,000 patients on my panel. How do I figure out of those who is at risk for the infection? And so that way I can make sure that their needs are met, because now I'm going to be closed for the next month or 2 months, but at the same time, I want to make sure that their needs are met, not only related to the COVID or coronavirus, but to also their chronic conditions that may be going on. And so getting a way to be able to mass communicate to a group of patients that could be either high-risk patients, that could be all your diabetic patients, and be able to ask them the right questions to identify, hey, is there a subset of these patients who are experiencing COVID-like symptoms? Are you having shortness of breath? Do you have a fever? Are you having cough? The next step was identify. And then so we're using this mass message ability to identify who amongst maybe my 3,000 patients need attention now while I'm closed, or while I'm running services kind of trimmed down relative to my normal services. And the third pillar is treat. So now once I have identified those patients that are at high risk or that may need attention, what do I do with them? So some of the subset of patients, for example, going down the COVID example, some COVID patients do well at home, but some need more urgent or more attention in a more acute phase or an acute setting. And so being able to figure out which treatment path they're going to go down. And again, it's about messaging them to figure out, to track their symptoms and be able to identify amongst those who will need a more urgent set of treatments.